Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss: is tramadol addictive? Tramadol, often perceived as one of the less potent opioids, fosters a misconception about its addictive potential. This mistaken belief can inadvertently pave the way for addiction to develop without individuals recognizing the risk. Abusing tramadol encompasses using it without a prescription, consuming it in higher doses, more frequent intervals, or for durations exceeding the prescribed guidelines. Additionally, combining tramadol with other substances to amplify its effects is also considered a form of abuse. The signs of tramadol addiction. While initially designed as a safer option among prescription analgesics, tramadol abuse and addiction persist as significant concerns. The effects of this medication have the potential to trigger similar substance-seeking behaviors observed with other opioid drugs. As an individual's tolerance to tramadol escalates, there is a corresponding need to elevate the dosage. This response stems from brain adaptations, necessitating a higher tramadol quantity to achieve previous effects. Tramadol addiction can manifest through 4 key signs. Loss of control over usage. Efforts to reduce or stop tramadol use prove ineffective. Intense cravings. Overpowering urges drive repeated actions to obtain the substance, perpetuating addiction. Doctor shopping. Seeking additional prescriptions from different physicians when refills are denied. Withdrawal symptoms. On cessation of tramadol, the individual experiences withdrawal symptoms. Individuals managing chronic pain conditions might develop a dependence on tramadol through prolonged use. However, alternative pain management approaches exist, offering relief without exposure to opioids like tramadol. What should you expect during tramadol withdrawal? Withdrawal symptoms associated with tramadol may differ for each person. Gradually tapering off the drug can help minimize these adverse effects. The common symptoms of tramadol withdrawal include agitation, anxiety, depression, cravings, nausea and vomiting, headaches, confusion, loss of appetite, sweating, muscle pain, blurred vision, insomnia, mood swings, diarrhea, nightmares, abdominal cramps. As tramadol impacts brain areas shared with opioids and antidepressants, individuals undergoing withdrawal management may encounter symptoms associated with both medication types. Moreover, secondary withdrawal symptoms specific to tramadol may arise, potentially persisting for months. These secondary effects might encompass restlessness, sleep disturbances, or dysphoria. Dysphoria manifests as a pervasive sense of unease or discontent, often accompanied by symptoms like anxiety, depression, or agitation. Dangers associated with tramadol addiction. Even when used appropriately under medical supervision, tramadol can elicit adverse reactions like nausea and dizziness in users. However, abusing tramadol significantly heightens its dangers, increasing the risk of severe side effects and potential overdose. Combining tramadol with other substances in polydrug use further amplifies the likelihood of severe and sometimes fatal side effects. Common side effects of tramadol abuse include nausea and vomiting, constipation, fever, dizziness, loss of appetite, muscle aches, depression, excessive sweating. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, emergency department visits linked to tramadol abuse or misuse surged by around 250% between 2005 and 2011. Severe symptoms of tramadol abuse usually manifest with higher doses or in combination with other substances. They may include seizures and central nervous system, CNS, depression. CNS depression occurs when the central nervous system slows down, potentially resulting in decreased heart rate and breathing, leading to unconsciousness, coma, and possibly death. Another dangerous side effect of tramadol abuse is serotonin syndrome, which can be life-threatening if not treated promptly. This syndrome arises due to excessive production or accumulation of serotonin, a neurotransmitter in the brain. Serotonin syndrome frequently occurs in individuals combining tramadol with antidepressants, displaying symptoms such as confusion, agitation, muscle jerking or rigidity, tremors, lack of coordination, seizures, coma, Typical drug combinations with tramadol. Frequently combined drugs with tramadol. Tramadol is often involved in polydrug use, where it's combined with other substances either to intensify the high or for self-medication purposes. In instances of tramadol addiction and abuse, individuals tend to co-consume the following drugs: alcohol, other painkillers, sedatives such as benzodiazepines and sleeping pills, cold medicine. The likelihood of developing an addiction to tramadol significantly rises when taken alongside other substances. Being a CNS depressant, mixing tramadol with other CNS depressants like alcohol, opioids, or sedative hypnotics can pose severe dangers. This combination can lead to respiratory depression, escalating the risk of seizures or overdose. How addictive is tramadol compared to other opioids? Tramadol's addictive potential compared to other opioids is a subject of debate within the medical community. Tramadol is considered an opioid, but its pharmacological action differs from other traditional opioids like morphine or oxycodone. Tramadol acts on the mu-opioid receptors, similar to other opioids, but it also affects serotonin and norepinephrine levels in the brain. This dual mechanism of action makes its addiction potential somewhat different from that of other opioids. While tramadol was initially marketed as having a lower risk of addiction and dependence compared to more potent opioids, studies and clinical observations have shown that it still carries a risk of abuse, dependence, and addiction, mainly when misused or for extended periods. Some individuals may perceive tramadol as less potent or less addictive, potentially leading to misuse or abuse. However, its unique pharmacological profile doesn't necessarily equate to a lower risk of addiction compared to other opioids. How is tramadol withdrawal different from other opioids? Tramadol withdrawal stands apart from other opioids due to its unique pain-relieving method. Unlike many opioids that work solely by activating brain opioid receptors, tramadol also impacts serotonin and norepinephrine reuptake. This means individuals might face a mix of symptoms. Typical opioid withdrawal symptoms involve nausea, abdominal pain, diarrhea, vomiting, muscle aches, general discomfort. On the other hand, atypical opioid withdrawal symptoms consist of hallucinations, severe anxiety, paranoia, confusion, depersonalization, unusual sensory experiences. While atypical symptoms are typically non-life-threatening, they can prompt risky behavior. For safe and supervised detox, seeking help from an inpatient facility is strongly advised. Tramadol addiction treatment. Upon completing detox, individuals may undergo various therapies and treatments as part of an extensive treatment plan. Rehab after detox is crucial for addressing underlying addiction causes. Rehab occurs in different settings. Residential or inpatient rehab. This involves residing on-site throughout treatment, receiving constant care, and participating in diverse therapies. Outpatient rehab. Requires traveling to the facility for treatment and returning home afterward. Ongoing medication maintenance is integral for maintaining sobriety and averting relapse. Medications like methadone, buprenorphine, or naltrexone may be part of this maintenance. Naltrexone, functioning as an opioid antagonist, blocks opioid effects, preventing highs if opioids are used again. Treatment for opioid use disorder encompasses diverse therapies and supports. Counseling, behavioral therapies, cognitive behavioral therapy, CBT, contingency management, CM, or motivational interviewing foster positive behavioral changes. Family therapy, vocational training, case management. Aftercare is essential for ongoing recovery. Comprehensive treatment should address substance use and associated medical, psychological, social, vocational, and legal issues tailored to individual needs. At We Level Up Treatment Center, our dedicated team of professionals is committed to guiding you through every step of your recovery journey. We prioritize your well-being and provide a nurturing environment conducive to healing and growth. Take the first step towards recovery today. Contact us to begin your journey to a drug-free life. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.